Hi. It's day 12 after my stimulator implant surgery that I had for pain in my SI and my hip area. And I wanted to do a follow-up for anyone who's watching, just because, sometimes it's really hard to know how you're gonna feel even a week or two after surgery. I realize there's only so much you can plan for with some things, but there are some things that if I had known prior to this I could have done differently. Yes. I had no idea how long I would be down for. Still, after 12 days, the muscles between my shoulder blades are just so weak, just below the incision, so they're really weak, and I can't explain, except for if you're holding something for a long period of time and you feel like you just can't hold it anymore and you're gonna drop it. It's kind of like that feeling. It's not even spasming, it's actually just sort of a deep ache that says, stop, you need to lay down. I also wanted to share with you some products that might help you if you have surgery of any kind in the future. One thing I started taking prior to surgery was some zinc, because it's a healer, it's a natural healer, but always check with your doctor before you take any supplements of any kind, because, even supplements are natural products, but they can interfere with medication and anesthesia and all of that. So always check with your doctor before you actually take any of the products that I'm suggesting. So first thing I have is a formula that my naturopathic doctor gave me and said to try. It's called BCQ by Vital Nutrients. It has, boswellia, 600 milligrams. It's got bromelain, curcumin, and it's the kind that's processed in a way that's absorbable. It's a really good formula. Quercetin is the main reason I started taking it. These are amazing in helping people with inflammation and helping to get their histamine levels higher, building up the immune system. This helps restore it, along with this probiotic. It's a really good formula, has great reviews on Amazon. I want to be very careful about taking too much of anything, because your body already goes through such a change in a state that all the chemistry changing, it's better just to be, less is better, let's just say. So this is a 25 billion CFU probiotic, highly rated on Amazon. You can find a really good probiotic. Start taking that for your gut. And then also, one thing that people are embarrassed to talk about, or they don't talk about, and that is really one of the most painful things following a surgery, can be just being constipated. And it's because the medication they gave you during surgery and then the pain medication following surgery can cause severe constipation. So if you get a heads up on that prior and you start taking something before, as in a laxative or even a stool softener before you go to bed at night, maybe a couple days before the surgery, well, that's what helped with me anyway. And so with Crohn's, I have so many issues with my digestion that I have to be very careful. You don't want to take too much of anything, especially laxative. So one of the things my naturopathic doctor told me about was this formula, or at least not this formula, but this product. You can buy it in a powder form and mix it in your drinks, but it's great for maintaining healthy bowel movements. So then also, here's the zinc formula that I took. I started taking that about a month before. It's called Zinc by Source Naturals. It had good ratings on Amazon, so I ordered it. The doctor said it's really important that you get copper along with zinc for absorption, probably other reasons too. But the zinc has 30 milligrams, and a lot of people think just get one over the counter, and it says 50, which is too much actually for most people. So 30 milligrams of zinc and 300 micrograms of copper. So check with your doctor on that, but that's a great healer. So I mean, my incisions are healed up so well, and I feel the body healing, and I always have whenever I take zinc before surgeries. The other thing I have here is called DGL. It's deglycerinated licorice, and it's great for soothing your stomach. So a lot of these medications can cause problems. Be sure you check with your doctor before you take you're gonna need to stay in bed. Because those lead wires shouldn't be moving, you should try really hard to keep them in place by staying still. You know, get down, if you can, I can get down like this, brush your teeth this way. You know, you can still reach everything, use a cup. And you know, you went through all this to get the surgery. The last thing you want to do is move those wires. So I'm trying, you know, it's great for the leg muscles too, because now I'm having to use my leg muscles to pull myself up. You will have muscle pain with the surgery. You are going to have a lot of muscle pain, and it's going to take months for you, probably in therapy, to get those muscles to behave the way they're supposed to. They actually are behaving the way they're supposed to. They've been traumatized and they've been cut into, and they're like, help. So just keep it under control by some massage and rest. Just make sure you get a good 8 hours sleep, because that's when your body heals. And you can have creams created at what's called a compounding pharmacy. I live in Oregon. There's one here called the Lloyd Center Compounding Pharmacy. I got this cream. It's got it's got gabapentin, ketoprofen, and then also it's got lidocaine in it. And so it's got 6%, 10%, and 5%. And what it is it's a cream. The gabapentin is a nerve cream, and the other one, the ketoprofen, can be actually any sort of muscle relaxer. And the other one is lidocaine, and you can only have so much lidocaine in your body because it becomes toxic. So I can only use a real small amount of this cream at a time, and I can mix it with oil, so it's actually then more diluted. But what it does is it helps with that severe pain, the nerve pain. Maybe you have it like I do, and I have mine in the hips, so if I put a little bit on right where it's really bad, it just takes that edge off. Here's what the tube looks like. But I mean, it's amazing how well those creams can work, especially if you get a good formula. So try out one of the compounding pharmacies. Ask your naturopathic doctor to create a formula for you, and then you can just, and my insurance actually paid for it. So don't be all, oh, insurance won't pay for it right away. You don't know unless you try. And I haven't been endorsed by any of these products. They wouldn't have any reason to endorse me. I'm just a little person making a video for you guys. So these are just products that I use and I wanted to share. I share with people all the time, so I thought, why not get on YouTube and share some of these tips? Because if they work for me, they could work for you. And if it makes the quality of your life better, what do you have to lose? After you've fully healed, I want to make it clear, don't put anything on your incisions that your doctor hasn't already approved that you put on. So check with them first. I healed up great. My stitches will go out tomorrow. I'm going in to get them taken out. But after you get all healed up, it's all completely closed up, I recommend this. I've done it with my other surgeries. On the scar tissue, the myofascial scar tissue can really cause pain in the future for you. So I use coconut oil. It's very absorbable. But also there's jojoba oil. I buy this organic jojoba oil, and it's certified organic. I put a couple drops in with some lotion, and I really love this Alba lotion. I just really love it. It's original body lotion. Coconut oil or anything. On it, you keep the scar, you massage it gently in a circular motion every day, maybe 10 minutes a day. You can really prevent a lot of that scarring from binding up, because if you do it every day, you have to be consistent, and you need to be disciplined and actually doing it every day, so that you can keep your body from having the deep scar tissue. I had a laparoscopy, and I literally felt a knob underneath of the scar, and I had been rubbing coconut oil at night, just laying in bed watching my Netflix, and I would just rub and rub and rub. And one time I rubbed and I felt like a release, and I was like, what was that? So there wasn't any pain with it, but I felt like it just kind of broke up, and I was amazed, because that was like the first time I actually really was good about putting the lotion on every day. My Chinese medicine doctor, he basically said, Sam, one of the best things you can do is take a warm towel and on your stomach where I had my cesarean, my C-section, and my other scars, he said take some coconut oil or some jojoba oil or shea butter, any of those type of organic products. Also, just rub them on really thick. And then he said just put that warm rag over them, put a pillow on top, and just lay there for a good half hour. And as you do that, your body's absorbing. Another product that I got at a market, it's from Sunset Beach Products, and I love it. I just love it. It smells so good too. It's called Sun Beach Products, and here's the name. He doesn't know I'm putting these products out here. I hope he still carries this, but either way, something similar would be fine. It's got a wonderful scent, like a nice menthol scent. And every time I put it on, the kids walk in, man, it smells so good in here. And so that's one thing that can help with the muscle pain. Okay, I'm crashing. This is what happens after about 10 minutes or maybe 20 minutes of me just getting up, brushing my teeth, doing my makeup, barely. I mean, just, 10, 15 minutes worth of activity, and I'm just like, I want to rest. So I'm resting, and so this is what I'm doing. And, when I lay flat like this, it's like, it's comfortable, but I can't help but wonder if I'm supposed to be laying on it like this. So I'm trying to get through to my doctor. But when I turn like this, I have to literally lift my body and sort of lift with my shoulder blades like that. And then lay on my left side. And so now if I want to leave, I have to literally take my feet and go like this, lift up, and then slowly lift up and move my body this way. So I'm literally using, now I can feel the sensation of my device. I can feel it in my knees right here. I can feel a little bit of tingling, and I'm thinking, oh, okay, so I'm going to shift a little bit because I don't think it's good to feel it. He said to tell me if he feels it to turn it down, but I think if I just move. So I'm using my hips, shifting like this a little bit without torquing or twisting my body. And so this is the way I've been sleeping, but the first week or two was awful. You can imagine the incisions were so, deep and everything. So when you turn, when I turned, it was just like excruciating. And some of the times it would just send like a shot of pain straight through the incision. So yeah, I have to say the first week was just hell. It was terrible. And then, like around I think it was like 2 days ago, I noticed that I'm not feeling as much of that shooting pain, except for yesterday I was on the phone and I was taking advantage of the fact that I wasn't hurting. And I just kind of turned and I went, and I was on the phone with someone and I was like, and had to explain why I was screaming on the phone because it came out of nowhere. So when I go in tomorrow to get my stitches taken out, that I'm going to be able to put on some cream, some lidocaine cream. There's no way they're going to take the staples out without me having some sort of numbing medication. I barely touched them today and just kind of pulled on it, just not like pulled, but just barely pulled on it. And I was like, I've had doctors before take out stitches and they're like, it's not going to hurt. And then they go and they take them out and you're like, oh, that hurts so bad. And then you leave and they don't have to deal with it because it's done. But make sure you tell your doctor that you want lidocaine cream and you want to leave it on for 10 minutes. The beginning part of this video is about me, day 12, my regimen. And then this is me after 10-15 minutes of just doing that, talking with you on the video, showing you some products. And I'm going to show you next a couple pictures of my incision as of last night, which would be day 11. Wait. Yeah, 11. So day 11's incisions, you'll see them on the next picture. I should have just done my entire video like this. It's so much more comfortable. This is how I've been for 2 weeks. I've been just laying around, watching Netflix documentaries and learning stuff. I actually learned how to play GarageBand and learned how to use Movie Maker. So I'm learning how to make better videos and all that. So it's kind of fun. So I'm going to school while I'm in bed. That's what I'm doing. And I'm making videos to help people. So I hope this helps you.